Hello. Now I will be saying you the important questions in the region of the upper limb. As said before, like every topic is important only in medicine, but still few questions I would like to say of which I feel like it is more important. I'll put star in front of it. To start with the essay questions of upper limb. First question is the memory gland, and the emphasis should be on more on lymphatic drainage and blood supply. In fact, the lymphatic drainage and blood supply can be a SAQ. Number two, the brachial plexus. You need to write its formation, that is root, trunk, divisions and cords. And the third one is axilla, its boundaries, its contents. And along with this, either axillary artery or axillary nerve can be asked. Shoulder joint. This is very important question. Then deltoid muscle and the structures under cover of it. Recently it was asked. Then we have the brachial artery and its branches. The emphasis will be on the applied aspect where it is used for recording the blood pressure. Then cubital fossa can be a SAQ, very rarely can be an essay question. If it is an essay, you need to describe the contents of the fossa in detail. Then we have the elbow joint, then radio-ulnar joints. This is important. A problem can be framed. A person after the road traffic accident is unable to do screwing movements, like is unable to fix a screw, is unable to pronate and supinate, something like this. A question can be framed. Then at which joints it occur, explaining about those joints is an essay. Then we have three nerves which are more important: ulnar nerve, median nerve and radial nerve. For all these three, a problem can be framed according to the distribution. Finally, according to the symptoms, what the question is, you need to find out which nerve it is and need to write about those three nerves in detail. Then we have intrinsic muscles of the hand, although bit lengthy but can be asked. Palmar spaces, this also can be an essay question, or individually the pulp space, or in fact the Whitlow, the applied aspect of the pulp space can also be asked as a SAQ or BAQ. Then we have the define pronation and supination, at which joints it occur, mention or explain the muscles which cause supination and pronation. So likewise question can be framed. Coming to the short notes or BAQs, the important ones: number one, clavipectoral fascia; number two, the serratus anterior muscle can be asked; lymphatic drainage of the breast, I said before, and even the blood supply of the breast can be a SAQ separately; anastomosis around scapula. Then we have biceps brachii muscle. Biceps brachii muscle can be asked. Then axillary nerve, it is very important. Axillary nerve separately as a short notes. Even in the short note, a problem can be framed. A person having a injury at the surgical neck of the humerus in a road traffic accident is unable to abduct the arm between 15 to 180 degrees. What structure is involved and explain about that structure, and that structure is axillary nerve. Then muscular spaces of the back, the quadrangular space, the triangular and upper and lower triangular spaces, about that it can be a brief question. Radial nerve in radial groove or radial nerve in spiral groove, the branches of the radial nerve in spiral groove can be a brief question. The question can be enlist the branches of radial nerve in the spiral groove. You know there are three muscular branches and two cutaneous branches. Then musculocutaneous nerve can also be asked because of its uniqueness, that it supplies a muscle and then becomes cutaneous. Then median cubital vein is an important clinical question. This is asked because of its applied aspect, that is, this vein is often selected for intravenous injections due to the reason which I think you know. Then palmar arches, very important question, superficial palmar arch and deep palmar arch as an SAQ. Flexor retinaculum or carpal tunnel, the front runner. Extensor retinaculum can also be asked. Then we have anatomical snuff box, the boundaries, the floor, the roof and the contents. Then palmaris brevis is unique muscle because it is supplied by superficial branch of ulnar nerve and is a gripping muscle of the hand. That's why it can be asked. The last one I can say is palmar aponeurosis. If you are thorough with all these questions, you need not worry about the upper limb. Thank you.